This segment is sponsored by Orthopaedic Associates of Muskegon, the largest orthopedic practice on the lakeshore with 18 physicians on their team. Dr. Aaron Potts is one of them, and today we're talking about sports medicine. I've heard the term a million times, Dr. Potts. I'm not quite sure what it is.
Yeah, so it's interesting. Sports medicine really, originally was designed just to treat, athletes. People think of, professional athletes, the physician running out on the field. But, really nowadays, sports medicine is really, evolved into a way to treat, athletes and non-athletes with soft tissue injuries in the most, cutting edge, minimally invasive way that we can.
You offer a huge range of therapies in this practice. Tell me about that.
We do. So we have many different physicians. Some of them are orthopedic surgeons. Some of them are primary care sports medicine physicians. Some of them are physical therapists, athletic trainers. So a lot of times the treatment can be non-surgical. So physical therapy, injections. We have physicians that can do musculoskeletal manipulation. So there's really a wide range of treatments that we can do, before even having the conversation about needing surgery.
If and when that conversation does come up and it's decided that is appropriate, people can rest assured you have access to the very latest in technology. What you are doing is cutting edge.
We are, yeah. So the surgeries now, as far as sports medicine anyway, can very often be done arthroscopically. So what that means is instead of making a standard traditional incision that will be several inches long, we can do many procedures through small poke holes. And so surgeries like hip surgery, where we're repairing torn tissue in the hip, that used to have to be done with a long open incision, but now we can oftentimes do that through just 3 or 4 small poke holes around the hip, and other surgeries such as ACL reconstruction or rotator cuff repair, labor repair in the shoulder. All of those can very often be done through very small arthroscopic incisions.
Obviously, that makes it changes the game for you, but also for the patient, right? Their recovery time and returning to some normal semblance of life much quicker.
It does, and that's where I think sports medicine has really expanded into non-athletes as well. Really, the goal is just to get anyone who wants to get back to an active lifestyle back as quickly as they can, and that's where these sports medicine procedures have really evolved, and I think really advanced the orthopedic surgical field, getting people back as quickly as possible.
Yeah, that active, busy lifestyle often leads to injury. This is where we need to talk about the urgent care center.
Yes, we have an orthopedic urgent care center that's open Monday through Thursday, 8 to 8, and then on Fridays, 8 to 5. So, anyone can, come in that has an injury, and we can do, treatments such as x-rays, injections, physical therapy orders. So, really it's a single stop, and we can get people on the road to recovery.
If you'd like to learn more about Orthopaedic Associates of Muskegon, you may do so on their website. We have put a link to it on ours. Go to 13onyourside.com. You'll find it there.